Welcome, everyone. The webinar will begin at the top of the hour and will be recorded. Connect with the Campaign for Grade Level Reading on social media. On Facebook, like the page Campaign for GLR, and on Twitter, follow the account at Reading by Third. Please use the hashtags GLR Reading and hashtag Learning Tuesdays and hashtag GLR Week to tag us or tweet anything you learned from today's session, and we'll be sure to retweet it. We encourage you to share your questions, reflections, and observations on social media. So once again, connect with the campaign on Facebook, like the page, Campaign for GLR, and on Twitter, follow the account at Reading by Third. The webinar will begin shortly and it will be recorded.
Welcome, everyone. My name is Jill Fioravanti. I'm a senior consultant with the Campaign for Grade Level Reading. We're really excited to have you here as part of GLR Week and as part of this exciting discussion. So you can go to the next slide. Thank you. This is a fishbowl conversation on the role of shared services and staffed family childcare networks. And this is the fourth in CGLR's sponsored discussions as part of our virtual GLR Week, which will be extending through tomorrow and started on Monday. To provide a little bit of context for this conversation, childcare, as you all know, is an essential ingredient to early school success, and COVID has thrown the childcare sector into crisis. There are lots of different proposals for what needs to be done to rebuild it, and models for rebuilding and how to pay for those models. Philanthropy, and particularly local philanthropy, has a critical role to play in helping rebuild the sector. And that rebuilding may very likely result in something that's different than was there before. The campaign's really excited to lift up some different models around shared services as part of that rebuilding effort to both local, state, and regional funders, as well as the wider Big Ten of partners in today's audience. And this fishbowl gives us all a chance to learn alongside and with our discussants today. And GLR is really excited about being able to learn along with all of you. You can go to the next slide. If any of you came on right before the top of the hour, you heard about our social media, our hashtags. You can see them here. We're live streaming this to Facebook. Please use the chat box to introduce yourself. Tell us who's on the line, your name, the organization you're with. You can go to the next slide. You're all on listen only mode. We are, because this is a fishbowl. We tried this yesterday with our first fishbowl. It worked great. If you have a question, we strongly encourage you to put it in the Q&A box. Preferably, you could put it in the chat box as well. I'm going to be monitoring the Q&A box, and if there's a question that seems like we can insert into the Q&A throughout this conversation, we will chat you privately, and at the right time, we will unmute you, so you'll be able to ask your question yourself. But we do need to see the question first, so please put the questions in, keep me busy. I want to be looking at that Q&A and the chat and helping moderate that. As Jerry, our producer, said, today's webinar is being recorded. That's going to be sent out to everybody. We encourage you to set your Zoom to gallery view, and you can hide all non-video participants with the 3 boxes in the top corner. That way you can see all our fishbowl discussants better. We will be posting a brief survey poll at the Q&A portion of the webinar towards the end. And then you'll be able to access the slides and bios that's in the chat box. It was also sent to any registrants this morning. You can go to the next slide. Just as a little bit of background about GLR Week, this spring we were forced to shift gears and change our plans for GLR Week 2020 and go virtual. And that gave us a chance to lift up what's happening all over the country, in states around the country and communities around the country, around early school success, elevating parents, and addressing COVID-related learning loss. You can go on the CGLR website to learn more about these sessions that we've had in the past, that we are having tomorrow, and to register for those and to get information and about the things that are happening all over the country. You can go to the next slide. This is a list of the different events that have taken place during GLR week. We're fairly far along in our week, but we do have 2 more conversations going on tomorrow. One that we're excited to lift up that's being run and sponsored by McKinsey, which is COVID-19 and education, ensuring equity as we address COVID-19 learning loss. And then lastly, a conversation that's going to be lifting up what's happening in California and South Carolina related to learning loss and diagnostic tools. You can go to the next slide. I'll revisit the next 2 slides later on in our discussion. You can go to the next slide. We have every Tuesday, we have Learning Tuesdays webinars from 3 to 4:30 Eastern, 12 to 1:30 Pacific. There's the 2 that are coming up are listed here, and I'll include information on how to register for those in the chat box, and you can go to the next slide. We also are announcing a new funder to funder conversation series. 1 has already occurred, 2 more are occurring starting Tuesday, the 21st and Tuesday, the 28th. And this is really in response to conversations we had with local and national philanthropy and an interest by both to really look at co-investment, co-learning, and sharing opportunities between local and national funders. So that's what this entire series is about on a variety of different topics. You can go to the next slide. With that, I'm going to turn this over to Shannon Katsaradis, the Chief Executive Officer with Nebraska Early Childhood Collaborative. Shannon's going to be moderating today's Fishbowl conversation. She's been phenomenal to work with, and it's been great to have you in this role in bringing this group together. So I will turn it over to Shannon. She'll make a few remarks, and then she's going to have the rest of the discussants introduce themselves, and we'll go into the rest of the content. I'll be back on towards the end, and we'll be monitoring the Q&A box in the chat box. Thanks so much.
Thanks, Jill. Good morning or good afternoon, depending on where you're joining us from today. It's my pleasure to both participate and moderate today's conversation. First, I just want to take a minute to acknowledge the Campaign for Grade Level Reading for their recognition that our nation's childcare system is in crisis and that it's a crisis that has the potential to undermine the campaign's school readiness goals. For those of you that have been in the field for many years, you know that our nation's childcare system has been in crisis for a very long time. And while it's difficult to see any silver lining in the midst of a global pandemic, the opportunity to build our childcare system back better offers a tiny glimmer of hope. Today's conversation is in part about making sure we seize the day, building on the great work happening in several states, all at different places in their journey around shared services, family childcare networks, or both. We plan to touch on 3 things today as part of our conversation: established models, new initiatives, and why a funder might want to consider investing. And we'll take some Q&A between topics. Lastly, before we jump in with some quick introductions, I want to lift up an issue for participants to consider. You'll hear the work described today as shared services, family childcare networks, or both. Fundamentally, this is all work that's about strengthening the business of childcare and supporting providers, which is critical to rebuilding our childcare system and ensuring that childcare programs are sustainable going forward. With that, I'm going to let today's discussion leaders introduce themselves.
Hi, I'm Judy Williams. I'm with Early Learning Ventures. I'm the Executive Director, and we're based in Denver, Colorado.
Sue?
You would think after 4.5 months I would put the mute button on. I'm sorry. I'm Sue Renner. I'm happy to be a participant in this panel and look forward to joining the day.
Hi there. I'm Jessica Sager. I'm the co-founder and chief executive officer of All Our Kin. We work with family childcare educators across Connecticut and New York City and have the great joy of partnering with the Nebraska Early Childhood Collaborative and others in this work as well.
Carrie?
Aloha, everybody. Good morning, good afternoon. I am the lead for Network Design and Innovation for the Hawaii Early Childhood Action Strategy. It's a collective impact effort that works on improving the system of care for our youngest children and families across health, safety, and learning. It's a pleasure to be here.
Aloha kakakiaka, everyone. This is Justina Acevedo Cross. Can you hear me? Yes, you can hear me. Justina Acevedo Cross from the Hawaii Community Foundation here on the island of Oahu in Hawaii. I'm a program director and very interested in being part of this conversation today. Thank you.
Hello, I'm Mary Louise McClintock. I'm the Senior Education Strategy and Policy Advisor at Oregon Community Foundation, a statewide foundation that is home to more than 3,000 charitable funds. We're based in Portland, but we have 4 regional offices around the state. Great to be here.
And now I'd like to turn it over to Judy Williams at Early Learning Ventures to talk about their model in Colorado.
Thanks, Shannon. I'm really happy to be here to share our model. Early Learning Ventures, we're a nonprofit organization, and we were started back in 2008 to really address exactly what we're talking about here today, offloading and strengthening the business of childcare. So the model of shared services that we deploy in Colorado, and we also are piloting in 7 other states, is using technology to help network the childcare programs. We work with homes and centers so that we can actually bring supportive tools to help them run their business better, from record keeping to compliance, to making sure that they are fully enrolled, that they know how to build their families, as well as pairing that with client support specialists. What that is virtual administrative assistants. So it's really a technology that is also fueled with a partnership approach. So it's not just throwing technology at providers, it's really using technology and giving that partnership approach so that we can actually support providers to use the technology to strengthen their business, to understand their business better, to get more time, get more dollars, so they can focus on what they really got into the business to do, to focus on delivering high quality childcare. The way we deliver our model is sort of through 3 levels of services. So we start with a very simple level of shared resources. It's a national technology platform that allows providers, as well as other folks that are supporting providers, to come in and share vetted, high quality resources, from cost savings programs to templates and so forth, so that people aren't recreating things that they need every day to run their business. But our core business is functioning on the technology called Alliance Core. We actually developed this technology so that shared services could actually be put together and you could network childcare programs. And this technology really focuses on offloading those administrative burdens off of providers so they can have more time to run their business, but also, again, pairing it with enough support, administrative support, so they can use these systems well. What we saw during this COVID crisis really highlighted the need to have technology and to have that networked through a group of providers. We were very quickly able to see across our network of 300 childcare programs, about 100 of them are home providers, the rest centers. Quickly we were able to see, because we had the real-time data, that we were able to pull and see who was open, who was closed, how attendance was going, and so forth. That really enabled us to take our resource, to dedicate our resources to those that needed the most help, those that were still open. So we have a lot of data around that that's really been able to inform that. So that's our second level of services. Our third level of services is our deep shared services model, and we use Early Head Start Childcare Partnership funding to go into that deep, not just the business services, now wrapping those pedagogy need of services, the full comprehensive services, around 45 of our members, and that is funded by Early Head Start. We were able to become the grantee and bring those services and supports down to local alliances. We are really focused on outcomes, as well as, you know, we need the business metrics. We're able to see their businesses, but we're also seeing over the 10 years of deploying our model, we are seeing a lot of performance metrics. We're seeing that providers in our network are scoring about 20% higher on the quality rating improvement system. We also are seeing that providers are saving dollars, but more importantly, they're saving time and able to engage in some of those high quality services and that are in the community to help them improve their business. We serve in our network, there's about 42,000 children that are being served on a daily basis through our network, with over 600 childcare programs. I mentioned that we are taking and scaling over the last 3 years. We're in 7 different states where we're providing pilots. And again, I think the key that we bring is our established model is we have the technology to network childcare providers, but more importantly, we have developed the processes so that we can give enough support with that administrative assistance to help providers in a partnership way. And then that allows us as a big organization to bring down more resources to childcare providers like the Early Head Start Childcare Partnership. I'll just stop there.
Perfect. Now I'd like to turn it over to another well-established model at All Our Kin. Jessica, would you like to jump in?
I would love to. Thank you so much, Shannon. It's such a pleasure to be here. And Judy, by the way, I'm a huge fan of Early Learning Ventures, so delighted to be here with you as well. So All Our Kin is a staffed family childcare network, meaning that we are dedicated to investing in, training, and supporting family childcare educators. We do this because family childcare educators receive the least support in most systems, and yet they are caring for the youngest children and the families that have the greatest barriers to accessing care. We have built a model for investing in family childcare educators that recognizes the enormous strength and commitment that they bring to this work and helps them to succeed as business people while also running really wonderful, high quality early childhood programs. So there are four main planks to what we do, and our model is unique, but you'll find a lot of these in many staffed family childcare networks. So the first is licensing support, helping caregivers meet health and safety standards and become part of a professional community of educators. The next is focusing on children's early learning. So through coaching and professional learning that is strength-based and holistic and rooted in best practice about how both children learn and adults learn, we help family childcare educators take the latest knowledge in the field and apply it to the education they offer in their programs. Third is business support. And I want to be really clear, what we offer is different than what Early Learning Ventures offers. Shared services platforms are really valuable tools, and training family childcare educators in the fundamentals of running a business so that they actually can manage their cash flow, enrollment, and other pieces effectively, I think are very much complementary. So we have a standalone business curriculum that we offer, as well as one-on-one business coaching to help family childcare educators execute on some pieces of the model. And the last important thing that we offer is connection and voice, helping family childcare educators build bridges with other community partners and helping community partners like pediatricians, K-12 systems, workforce development, recognize the value of family childcare. Like Early Learning Ventures, we are very outcomes focused. So I'll just give you a little bit of snapshot of some of those outcomes. So we have seen that we've been able to build the supply of childcare by 74% over a 10-year period, while the supply of family childcare fell around us as it does across the country. We have seen that our family childcare educators score over 50% higher on research-based measures of quality, and our children outperform peer and national norms on language and literacy, social emotional development, and problem solving. We've seen that our caregivers earn more. After our business coaching, sometimes on average, an astonishing 90% more in their programs. And our investment in family childcare educators, according to the University of Connecticut, generates a return of $15 to $20 for every dollar we invest. We began in New Haven, Connecticut. With the support of many folks on this call, we are now in cities across Connecticut and in New York City as well. We work with about 1,000 family childcare educators who are reaching 6,000 children. And now we have begun to engage in technical assistance partnerships with agencies across the country, starting with our dear friends at the Nebraska Early Childhood Collaborative, but looking to partner with others as well. I think a key value of All Our Kin is to recognize and build on the strengths that exist in every community across the country and provide technical assistance to the many wonderful agencies that are engaging family childcare already and could benefit from some of our tools. So I want to speak just very briefly about the present moment and about COVID-19. As you know, childcare programs are closing across the country. Family childcare has been the most fragile to begin with, and is at enormous risk now. At the same time, we see that family childcares are staying open in higher numbers than centers, often because they're caring for the children of essential workers. We see that family childcare educators, open or closed, are going above and beyond to support families. So even if a family isn't coming, the educator is calling, she's having video chats, she's connecting families to sources of basic needs, and she's dropping off materials at programs. And finally, we at All Our Kin have pivoted to support those family childcare educators, focusing on health and safety, economic stability, and their and the children in their care, social, emotional well-being. So I'd be happy to talk more about that offline. For now, final lessons learned. I think this moment is our chance to invest in family childcare through strategies like the ones you're hearing about today, so that on the other side of this terrible crisis, we can actually build something better and stronger that will serve us well moving forward. Thank you.
Thanks, Jessica. And I'm actually going to round out the field today and talk a little bit about the model we have at the Nebraska Early Childhood Collaborative. We are a relatively young organization compared to our peers at ELV or All Our Kin. And we have what I would describe as a hybrid approach that includes both shared services and a staffed family childcare network. I just want to touch on our shared services first. We provide deep shared services for 6 high-quality early learning centers. They employ about 375 staff and serve about 800 at-risk children, both in Omaha and Lincoln, Nebraska. And our shared services includes comprehensive HR, financial management, professional development, and a substitute teaching pool. We have a fee-for-service contract with those service centers for the services that we provide. And in the post-webinar email, there'll be our full scope of services. I wasn't going to dive that deep today, but I think what I would say, just to give you a sense of the depth of the services we provide for those centers, none of those buildings actually have HR staff or financial staff in the buildings. Those are all things that are housed in NECC's back office. With respect to our family childcare network, that's actually a new addition to our work. We have 3 tiers of service. At the lower level of support, just to echo one of Judy's points, there's technology that is part of each tier and an important part of the work, I think, in shared services. At the lower level of service, they're supported by CCA Global's shared ECE resource, or the Knowledge Hub, as you might hear it called. We call it the Nebraska Exchange. And we provide additional lower touch supports to those providers. At the highest level of service, we have childcare management software, access to grant funds that allow providers to enhance their technology, educational materials, or health and safety, as well as other higher touch supports that are available. We, as Jessica mentioned, we've also had the privilege of working with All Our Kin to bring some of the great elements that they have included in their work to Nebraska through a pilot. And that includes the business training series, business consultation, as well as a licensing toolkit inspired by the work in Connecticut. And we include that in our tiers of service for our family childcare network. And in the email post-webinar, you'll see those tiers of service as well as our grant funds described. I wanted to share a couple of lessons learned, and then I would actually welcome Judy and Jessica to jump in with other lessons learned they have around shared services. So just from the collaborative's perspective, a few things we've learned. Much easier to engage with providers that are earlier in their career or new providers to the field in terms of establishing best practices from the start. I think that's been a key lesson learned for us at the collaborative, and we're focusing more of our attention through the licensing toolkit on providers that we've just engaged. Being clear upfront about the scope of services. I think scope creep is really real in this work, and there have to be accountabilities on both sides for it to work well. What we do versus what you do and what we don't do, I think, is a really important part of being successful in either shared services work or a family childcare network. And then I think lastly, speaking to both of my colleagues here, talking to the many other people that have already blazed this trail, both Judy at ELV and Jessica have been great partners in our work at the Nebraska Early Childhood Collaborative. I learned a lot. We were able to move forward much more quickly, identify the right tools for Nebraska, and I think benefit from their lessons learned from blazing this trail long before we got here. So I'd encourage others to really lean on state partners as they think about engaging in this work. Judy or Jessica, do you want to jump in with additional lessons learned?
Sure, yeah, I would definitely echo you. I mean, as we all know, this is very much a relationship type field in early childhood. So I definitely think that getting them at startup is where you can get them off to the right start with the right tools, and that's a great lesson learned. But I also think what we've learned is actually meeting providers where they're at. Everyone's got the potential to do continuous improvement, and it really starts with meeting them where they're at and solving that problem. And we've been able to do that by looking at their business around the record keeping. I think family child care providers, small centers, even large centers, everybody struggles with keeping up with the record keeping and compliance. So really meeting providers where they're at, listening to providers. I think I've learned that over 10 years. Lots of people do focus groups, but you really have to listen to the providers and let them inform on the services that are going to make the biggest impact in their business. I also think that technology is got to be part of the solution, and it's got to be user friendly to providers. It has to meet their need. They have to be able to have input in how the technology works for them, and it needs to bring them enough benefits so that they actually are actualizing that time and money back into their program. So then they can raise their heads up and start to get involved in more of these quality building programs. So I think we've learned that, and I will definitely echo you. There's so much work that's been going on over the last 10 years that coming into looking at this now, it's like, don't recreate. We tell providers all the time, don't recreate, look at the models that are out there and leverage the tools and the expertise that's out there so you don't have to build it all yourself. There's so many things, and I think Shannon, the way Nebraska came and visited us, and you went and visited other things, and you were able to then bring your model together, leveraging the different aspects of other models. But technology's been huge. I want to, again, during this COVID crisis, having all that access to the data and the children and the programs, we were able to quickly inform our state, and as well as bringing relief to programs and services that they need.
So I will completely agree with everything that has been said. And I want to just share a few more things. So first of all, I'm so glad that Judy, that you talked about listening to family childcare educators. And I would say, really, I would go further and say, making sure that educators' voices informs your programming, and exploring ways where family childcare educators can and should actually be leaders in your programming and in your field. So just to give a really quick example, we've been doing a lot around translating public health guidelines for family childcare. We've had nurse consultants present, and they've been really effective, but it's hard to implement these guidances in a family childcare home. We've been having family childcare educators present at panels about the strategies they're using to implement these recommendations, and the creativity, insight, and knowledge that they bring is phenomenal and is really informing across the field. The second thing I would say, education and business are not separate. They go hand in hand. We began by focusing on high quality educational practices, and those are wonderful. But if someone can't stay in the field, that continuity of care, that valuable educational support is lost. I also think, as a matter of equity, it's essential that we really insist on finding ways that family childcare educators get adequately compensated for the incredibly important work that they do. And that leads me to my third lesson learned, which we came to sort of latest of all, which is that policy really matters. And those of us on the ground need to be speaking up about the policies and the funding streams that are necessary for our work to have its full impact and effect. So I'll leave it at that. Thanks.
Great, I appreciate those additional lessons learned. I think we'll transition and take a few questions from participants. Elaine, I understand you have a question. Would you like to introduce yourself and ask your question?
Yes, I do. Lane Polikoff, Broward County Public Schools, Broward County, Florida. I was wondering, with the several states that are here, Oregon, Hawaii, Colorado, and of course Nebraska, has there been any guidance from your state Department of Education's or Office of Early Learning's that give you guidance on how to deliver your preschool programs once the school year starts, if their schools are going to be closed because of the COVID virus?
Sure, I can share from Hawaii. Our Department of Human Services put out guidelines for our private family child care and also our center-based care, as did our Department of Education. So we have guidelines from both. And we also built in some support. Department of Human Services built in some support to provide some, through their licensing workers, some support for how to implement those guidelines, which has also helped. It's very challenging, as everyone on the call can imagine, but there are guidelines out there.
When you say guidelines, do you mean for delivery of services, for how many children they can have within the school at a certain time?
All the above.
Okay.
I would echo that too. In Colorado, specifically in the childcare market, where I'm talking about birth through age 5, but of course can go up to school age for the summer. Colorado has completely reopened licensed childcare, so they're with new COVID health and safety, but they're able to actually go back to their licensing capacity. And there is a lot of different support coming down through our Office of Early Child Licensing, Department of Health. But what we're finding is there's so much information for providers to decipher and figure out, and to find their support and find the most updated, because things are changing on it every minute, it seems like, that being part of a network or a shared services group, we can decipher all of that for them. And again, I think that's where then we can hone into, because it's also, we're statewide, so we have providers in different counties, and the counties are a little different. So really being able to decipher, there's so much information coming down. Our schools, in terms of Department of Ed, they're still, again, deciding how that's going to look, when they're going to open, what that's going to look like. So it's really putting a strain to childcare, because school-age children are in need of care as parents go back to work. And typically, childcare will do some school-age, but not the amount that's needed right now. So I'm not sure if that's answering your question.
No, it does, because that's the discussion that we're having, because the decision was made for the public schools to be closed. So now the private providers are looking and saying, hey, can we have our school-age kids full day and provide them with the technology that they need to do their schoolwork, so that they're here a full day. So that discussion is just starting to happen now. We've been having it, but until a decision was made, there was nothing final done. So now we have to look, because it becomes a licensing issue for the number of children, school-age children and preschool-age children, and so forth. It changes a little for that. So I'm glad that and we are starting to get guidance on that as well. But like you, we're several different counties throughout the state that have different rules and regulations about mask wearing and those types of things.
Can I chime in just with one thought, Shannon, before we move on? At the Hawaii Community Foundation, with the guidance coming out, we knew that for some of our nonprofit sector and childcare, many of our childcares fall into that nonprofit sector piece. It was going to be difficult out how to reopen safely, both for their staff, but also for the families and kids that they serve. So we've actually engaged with a group out of Arizona called Healthy Verify. They're affiliated with the Arizona State University to basically help do some translation on those guidelines, but actually put them into practice. Like, how are you going to do this in your child care center? And they could, once they develop the guidelines for the sector at large, people can either choose to adopt them or not. If they want to, it's totally voluntary, but it was meant to be kind of a complementary standard that people could take on, and then also have access to medical expertise as they come up with like real questions that they're facing about how to open childcare. And the reason it kind of fits in this conversation, and because I actually thought of it as a interesting way that we're entering into shared service, because we were looking at like what's a real need that childcare is having right now. And so we're planning to do a similar project with for our family childcare providers on developing guidance that they could choose to adopt or not. And we hope that that's helpful.
So I can't speak to the states that were listed in your title, but I can definitely speak to what's happening in Connecticut and New York City. Maybe I'll just focus on Connecticut for reasons of time, because I'm actually really proud of what the state of Connecticut is doing around family childcare. First, I'm going to just quickly define family childcare because we did get that question from the field. So there are a lot of different terms for what's called home-based childcare, which is essentially community members opening their homes to care for each other's children. At All Our Kin, we use family childcare to refer to licensed home-based programs. Sometimes they're regulated, sometimes they're called listed programs. But in thinking about what All Our Kin does, we can think about the whole universe of home-based childcare. Our Commissioner of Early Childhood, Beth Bai, in Connecticut, has been sensational in the face of this crisis. And one of the things that she's done to ensure that family childcares are ready to respond to the needs of the pandemic is to actually get money from philanthropy to build networks like All Our Kin in other parts of the state. She's also worked to set up nurse consultation hotlines and mental health consultation hotlines, which I think is phenomenal. Programs here are open for the children of essential workers, and they will be continuing to opening as our state recovers. We may have to back that up some, but most of our family childcares are caring for the children of essential workers, so they've been open throughout the pandemic. We also know they will be caring for school-age children. We at All Our Kin are ready to support them in the challenging pedagogical aspects of this, but I will name the digital divide as one key issue that we are going to have to address to make sure that children can participate in remote learning while they're also attending family childcare programs. So I want to name that as a major issue anyway, since technology is now the main way family childcare educators can interface with each other and with support systems like networks, plus, of course, shared services.
I think maybe thanks, Jessica. I think maybe we're ready to move to our next question. Kristen, I understand you have a question. Can you introduce yourself and ask your question?
Yes, hi, this is Kristen Bernhard with the Ounce of Prevention Fund. I'm curious, thinking about these amazing efforts that all of you have led and implemented, if communities are not quite ready to get there yet, what are the types of enabling conditions that have made your efforts successful when you explore opening new family childcare networks or new solutions? What could community leaders be working towards right now that might help make future more organized efforts successful?
So I just jump in and echo the earlier theme. I know for myself, there was a great value in really, I had the opportunity through the Opportunities Exchange to do a shared services study tour and then to visit many of the outstanding programs across the country. And there was great value in really seeing the work in action and getting to understand the many strategic choices you make along the way. So I think really taking the time to be very thoughtful and visit programs that are already doing this kind of work and think about how that fits in your local context is time really well spent on the front end.
Yeah, I think that makes so much sense. And I would say the main issue in a community is how much willingness and appetite there is to do this work. It's interesting because we began offering technical assistance that was around things like offering our business training. And then we realized you have to have something to build on in order to do that. So we're actually creating and refining a technical assistance strand right now that's all about how to build a staffed family childcare network. And really what you need to begin is a hub that is committed and excited and values family childcare educators, and you can build up from that. Your hub may be your local childcare resource and referral agency. It might be a workforce training agency. It might be a childcare center. It might be an agency. We have seen all kinds of partners. It might be the union, right? There are so many partners who we have seen begin to engage in this work. You have to be willing to develop your staff and support your staff in taking time to do this work, building relationships with family childcare educators. And then I think really you can build from there. If you know your community and you have those relationships, that's the most important thing. The other thing I'll say is stable funding streams. So that's both, you know, how your childcare subsidies work. So whether family childcare educators can afford to do this work. But I think it also, for those of you on the call who are local philanthropists, it speaks to investing in those partners to make sure that they not only can build a network, but can then keep it running. Because we have been invited in to do technical assistance in communities where we've heard, we had something amazing and we couldn't keep it going. So I think stable funding that continues over time is really essential for this field.
I agree with both of you guys. And I would just say that what we're seeing as we're piloting in different states is there are already sort of, this work is being done and it's looking at what kind of supports are coming down already and who's trying to support groups of family childcare providers and centers to improve quality, to help them with their business and record keeping. A lot of that work's already going on. It's just looking at systems to network them and organize it so that they can actually officially become an alliance. And then there's some of your stable funding streams. I believe some of that funding is already coming down and it's rethinking, you know, if you're just coaching to a quality rating improvement system and that's it, and then it's done, you know, trying to rethink how some of those different strategies can be funneled into a hub and a shared services and also sustained. And definitely sustainability is the biggest thing. You can't get these up and going and then walk away. And that's been really important with us, is that we have different funding streams that come in to help do some quality supports, but our business services is a shared cost model. Providers pay a small fee, so they have to get enough benefit to make that business decision and stay with us, as well as philanthropy pay some of it and all of that. But you've got to have something that as the funding ebbs and flows, that network is going to stay stable throughout, so that they, you know, kind of like what you said, Jessica, oh, there was this great thing I was part of, the funder went away and now it's gone, and so I don't get any support anymore.
So before we transition to our next topic of discussion, we're going to pause and take a moment to do a poll. So thanks, Judy and Jessica. Great remarks and certainly great experience. It was wonderful to hear about the great work you're doing in Colorado, and Jessica, as you grow your work beyond New York and Connecticut to other states across the nation. We're going to transition now and talk a little bit about states that have new initiatives underway, specifically Hawaii and Oregon. And I'm going to turn it over to Carrie and let you kick things off.
Great, thank you, Shannon, and thank you, everybody. Yeah, it's been an interesting journey, I think, for everybody on the call the last 4 to 6 months. The conversation of shared services and childcare networks and FCC networks has been in the network in Hawaii for a long time, for years. And I always like to say there's the right timing for innovation, and the stars and the dots tend to have to align in order for innovation to be really successful. And so similar to what Shannon shared, is I think right now is the perfect time to look at these innovations in the wake of COVID, and how do we do that? And for Hawaii, it was really kind of 4 big pieces that have come together for us to even be able to consider this. The first is within our network, we have an equitable access team that had developed an infant and toddler work plan, of which shared services and family childcare networks was prioritized as a high need. So we've been holding space for that for quite some time to figure out what that might look like. You know, we received national support for that as well. The second is our community colleges and our university have been working on creating pathways for family childcare between our community college and then articulating up to our flagship university as well. And that's been critical for the systems building. In January, a big bill for Hawaii to do rapid expansion of childcare and preschool for 3 and 4-year-olds was introduced. It was interrupted with COVID during our session, and then it was passed last week, which was quite extraordinary and very challenging times to get passed. And that provides some of the infrastructure needs that we would need to have something like this be successful. And then the fourth thing is our Department of Human Services has done a really nice job of responding to COVID in creating, removing some of the waivers, making sure that they are trying to remove barriers for programs to stay open. And so all of this kind of coming together and recognizing that for our family childcare in particular, this is a critical time. It's also a time for families that may choose smaller environments to keep their children safer, that we might see a higher demand for family childcare also. And so we are seriously brand new, like our funding memo for this work, it just got introduced to our funders group yesterday. So we are very, very new to the actual implementation of this and the piloting. We're so grateful to everybody on the call. We reached out back out to Colorado. We had reached out to them 5 years ago. Reached back out to Colorado to learn about early learning ventures. We had reached out to Nebraska to find out about their Nebraska exchange. Really excited to learn about Oregon. And All Our Kin has been in conversations for a decade here in Hawaii. So I just want to really spotlight everybody on the call in terms of not to repeat or don't start over, right? There's so much good work out there already, and we've learned a lot. And I think the biggest thing we've learned is start small and start with a small cohort. And so we're hoping to this fall or early next year to start with a cohort of 15 or 20 family childcare providers using the Early Learning Ventures platform, learning from Nebraska Exchange, other bells and whistles that need to be included. And we're going to pilot and see how this goes. And some of the learnings that we're looking at is to learn, what family childcare providers need most to sustain their businesses. And then we want to tailor the platform and the shared services accordingly. The second is to learn more about what infrastructure and tiers are most helpful for a shared service model for Hawaii, to identify strategic partnerships, to really identify those sustainable financing models. Anything we pilot, we want to make sure has legs and can sustain for the duration is critical. And to keep participating family childcare businesses in business and to entice new family childcare providers to open up businesses. I think like most states, we've lost a lot of family childcare providers, and we're hoping that by offering these services that this will also entice new providers to open up businesses and think more on an entrepreneur track, that this might be an opportunity for them as well. So we're just really excited for this opportunity and for learning. And we hosted, in the midst of all of this, have hosted multiple focus groups so that our policymakers can make the most informed decisions on how to use the CARES Act dollars. And it was amazing to sit in on those conversations and listen to the family childcare providers in particular. Be so grateful to have a platform. It was all Zoom, but to have a platform to communicate with one another and to share what's happening for them and trying to reopen what's happening for their families that they're serving, and be able to do that cross-learning. And so I think that networking piece is also really critical. We have some of that in Hawaii. It isn't systematized. And so how do we do a better job of providing that networked support for family childcare is also something we're really hopeful for as well. So with that, Justina, do you want to add anything here? I know you'll be talking in the funding section as well.
I will. I just wanted to, I guess, not echo, but amplify a couple other things that we really learned. And it was thanks to people who are in this fishbowl with us. So what's nice about this is we get to approach it really with we're at the start and the beginner mindset on it. So a couple other things that really struck me, because I think coming into this conversation, and maybe this is a place where a lot of people come into thinking about shared services. Of course, we came into it because of that we're just seeing, we don't know, we have a lot of uncertainty about whether or not family childcare providers are going to make it here in the state, and what else can we do to really help to stabilize the field. And then thinking about shared service, I think I had that very simplistic view that it was going to be around helping to support savings, cost savings, time savings. And if you take one thing away from this conversation and webinar, it's really about also the relationships that get built. And that's the critical role of whoever kind of starts that shared service model. So in learning about what other places were doing, one thing that was particularly helpful was thinking about kind of the who could start out a shared service model, who should we be looking for? And that mindset is a bit different than I think what we would normally think about in the field. So having someone who brings more of an entrepreneurial role and could have a bit of a business mindset and build the right kinds of relationships with our family childcare providers felt important. And then also thinking about where to start, because the things that I thought of with shared services were a lot of what we call deep shared services. But in starting small, thinking about the things that really have value for providers that are not necessarily those, those deep shared services like the tax preparation or when you get to that. So that for me was really important in us launching, and it's probably saved. So just on the theme of saving time and money, I think it's really saved Hawaii time and money as we pursue some sort of shared service model to start with our family childcare here.
Kudos, Carrie and Justina, on an early public policy victory. That's great news for Hawaii, and thanks for sharing some of your early journey. Carrie, I'm wondering, or Justina, if you might be able to clarify in Hawaii how the colleges or community colleges or university system are working with your family childcare educators. We had a question from chat.
Sure, I can share. So Windward Community College, which is actually in our town, in Kaneohe, has been a partner for the last 4 months on this shared services work. So they have a pathway that they're designing for family childcare and it's through what's called Human Development and Family Services degree, where they can, they'll bring students through. The students have an opportunity to actually stand up the family childcare business. But they also then can go on to academic pathways in early childhood education through our other Honolulu Community College, and then onto the flagship school. And then they can also go into business, or they could go into FAMR, Family Resources and Social Work. So it gives them multiple pathways, and it's very new. They're just developing that, and we're providing, we're looking at this alongside the shared services and how do we make sure that this is complementing one another. And within Windward Community College is a program called Learning to Grow, and Learning to Grow provides a lot of quality and professional development support for family childcare and for the network at large, and they're housed at Windward Community College, which is really nice. And we also have an organization called Patch that works with our community colleges as well to provide the business support. So what do students need to know? What do potential new business owners need to know around how to start up a business? And they have a curriculum for that as well. So we're partnering with a lot of different entities, but the entity that really took the lead on this in the last 4 months was our community college here at Windward.
Great, Carrie, thank you for sharing that. Very helpful. Mary Louise, would you like to jump in and talk about what's going on in Oregon?
Yes, thank you. So at Oregon Community Foundation, we are working on a new statewide Shared Services Alliance initiative. I want to emphasize that it is still very early and exploratory for us. Our initiative hasn't even been approved by our board yet. We're hopeful that that will happen next month. So I'm definitely learning much more from my colleagues on this call than I am able to share. But that being said, we had already dipped our toe in the water with a pilot Shared Services Alliance in a 2-county region on our southern coast, just north of the California border, that had lost an alarming number of programs even before the pandemic. We awarded a grant to a community college last summer to coordinate this project. And though the arrival of the pandemic has slowed forward momentum, it is now they're launching recruitment to the program. I'll just say that Louise Stoney of Opportunities Exchange has been a consultant, a regular consultant on that project. It's been great to have her involved. It's the first Shared Services Alliance in Oregon, and we understand it's one of the most rural and sparsely populated areas of the country to try this approach. So even though it's still pretty untested in Oregon as an approach, we're moving ahead right now to explore a statewide initiative. This has grown for us out of an immediate short-term initial limited response to the pandemic crisis back in March, when we were asked by the State Early Learning Division to hire a consultant to set up a source of information for childcare providers to help them navigate the new landscape. This became what a program called the Childcare Provider Relief Guide that includes a website, access to geographically based peer coaches to help providers navigate the new terrain and learn about and cope with new regulations for health and safety and workplace, and also access business assistance. Other funders have kicked in funds for this too. And importantly, the project has been overseen by a coalition of stakeholders, advocates, a child care resource and referral agency, and child care providers. So when we as a foundation decided to pivot to looking at the longer term and at how to take advantage of this moment in time to pursue strategies to strengthen the child care system longer term, this Provider Relief Coalition has, the fact that it was in place, has helped vet ideas. Briefly, where we are now, we're taking a recommendation to our board for a 5-month planning grant that if it's approved, it will have goals of identification of a statewide backbone organization that we envision could provide some assistance and services to family child care providers and center-based providers, whether or not they're formally participating in a shared services alliance. It would include partnership and with and co-creation by providers from communities of color, from rural areas, the business community, the state of Oregon and other funders, selection of up to 2 communities in which to launch additional shared service alliance pilots with local backbone organizations, adoption of a child care management software program that would be available to all providers in the state. And also, and this may be different from some other states, we're exploring potential financial partnerships with community development financial institutions, which could include a loan fund for child care providers as a way to increase access to capital. All of which, during this planning phase, we hope would lead to a proposal to our board for a large multi-year initiative that would be rolled out next year with, we hope, participation from other foundations in the state and from donor advised funds that we work with. We're envisioning a total of up to 5 shared services alliance pilots that would be working with diverse communities, diverse regions of the state, and much more to be developed as we embark on the planning phase, if we're able to do that starting next month.
Thanks, Mary Louise. It's great to have perspective from somebody that's early in their journey around shared services. So thanks for sharing. We have a question from a participant. David, would you like to introduce yourself and ask your question?
Sure. Can you hear me okay?
We can.
Okay, great. Yeah, I work with a company called Nonviolent Communication for the Next Generation here in Hawaii. We're actually on Maui. And we are mostly focused on working with the schools, but we're looking at how to support parents at home, and just even internally within our own organization, we've noticed that there's such a huge need for childcare as no one's able to go back to work full time and find solutions for their kids, and it doesn't look like many schools are going to go back to school full time. So, you know, this is a topic near and dear to our hearts. We're not quite sure how we can help, but we were thinking more along the lines of trying to partner with other organizations to support parents, and wondering if there's kind of a way to do this at a more grassroots level. Like I was thinking, Judy, when you were speaking about, systems, I was actually thinking about systems for groups of parents, people to get together and support each other. In other words, is there a way to do it as a sort of a home-based type of initiative where we're supporting groups of parents and watching each other's kids, doing a co-op style solution so that there's no cost involved necessarily, or minimal cost involved, or having parents share childcare resources somehow and utilizing homes. And I know that I don't know what the liability ramifications are there, but I just think it might be a really valuable solution for parents who can't afford childcare to be able to get it and support each other. And I wasn't sure if there's any thought or discussion that's been made around that possibility.
David, this is Carrie. I just wanted to share, it's nice to meet you on Zoom, even though you're in Hawaii. I'm looking forward to connecting later. It's an interesting question, and it's actually an interesting concept. I'm on the board of a school that serves children ages 2 through 12. And we're nervous because we've heard families talking about forming these little groups and rotating their kids and co-teaching their kids as a way to, because so many people have lost their jobs here in Hawaii due to the tourism industry still being paralyzed. And so I do think there's an interesting interesting opportunity or an interesting structure that may emerge from this COVID that we may not be prepared for.
So thanks very much again to Hawaii and Oregon. I think we're going to go ahead and transition and hear from the funders we have. But before we do that, we are going to share the poll results. So transitioning to the perspective of the funders that we have on the call today, I'm wondering if we might be able to start with Sue Renner. Sue, can you jump in?
Sure, and I'm unmuted now. I kid you not, you would think after all these months I would get this down, but I'm still struggling with that darn mute button. Again, I'm Sue Renner. I'm really happy to be here. I'm the executive director of the David and Laura Mirage Foundation here in Denver. And we got into this work about 12 years ago. Like many on the call, worked very closely with Louise Stoney. And I want to really lift her up and give her credit for the work that she has done really in a very dedicated and committed way all of these years with shared services. And we started on our journey looking at childcare financing. It was really upsetting to David and Laura. They're both immigrants to the United States. And when they found out that access to childcare was really dependent on family income, or access to quality care, I should say, was dependent on family income, it really bothered them. And they said, Sue, we really want to work towards some sort of universal access to quality. And it was on that path that we discovered this supply issue. So while we're working on the policy side, which we're still deeply involved in, David was really concerned about the supply of care. Now we know about childcare deserts. We didn't know as much then, but we knew that we had a supply issue. So we decided to sort of divide our efforts between policy, increasing the public investment in early care and education, and in the infrastructure. How can we make it possible to open up a successful childcare business and to be able to deliver the kind of care that truly anyone that gets in this business wants to deliver? We started looking at that and had our eyes open to this idea of shared services. One of the organizations that was a mentor to us was Infant Toddler Daycare Inc. in Fairfax, Virginia, still a thriving family childcare network there. And they allowed us to really come in and look at their business model and look how they operated. And it was through that David and Laura made a commitment to testing a model that could be replicated. So we intentionally went into this over a decade ago with the idea that we wanted to develop the tools, the technology, the protocols, the procedures that could be copied. I mean, that's exactly what we wanted to do. And We have been at this about a decade. The question earlier about lessons learned, I think that's an important lesson. These networks take work. They take a deep commitment. And yet, the exciting thing is now to see ELV scaling and to see, like Judy mentioned, that these base shared services, not the deep shared services, but the base shared services can be supported by the members. And there's not a lot that we can say about in the childcare sector quality improvement world that members can support themselves. And this is one of those areas. And that's what's really gotten us excited about this work now, is that through technology, through automation, you can deliver a really wide array of services to providers at a reasonable cost. I'm not saying that that is not costly, but it's a cost that once these small businesses get whole and are fully enrolled, they can share in that cost, as Judy said. I think something else I want to point out is that I agree 100% that this is the time. Like, this is our moment, you guys. Like, childcare is on people's radar like it has not been in my professional lifetime. And so really, for those funders that are on the call, communities that are thinking about doing this work, get serious, because I think we're going to have opportunities at the federal level for investment in networking. I think states are going to get more interested in investing in these networks. And clearly, childcare providers are literally starving for support. So whatever we can do now in 2020 and into 2021, truly shame on us if we don't do it. So that's kind of my position as a funder. We remain very, very open to working with others, linking arms. Anyone that has an interest in learning more, please reach out to us. And like others have said on this call, I mean, we're ready to be mentors. We're willing to be mentors. And the cool thing is, everybody on this call is coming from a philanthropic side of the work. So there's a sense of share and share alike. And we really do want to leverage the investment that the David and Laura Mirage Foundation has made into this work. And we will continue to look for new ways to add value.
Great, thanks, Sue. We appreciate that. Justina, would you like to jump in and just talk about things from a funder's perspective in Hawaii?
Sure, and I really appreciate Sue's, you gave a great call to action. I was gonna mention, actually, for us, there's been sort of 3 entry points why to think about shared service now. But probably the biggest one, earlier we had the question, I think it was from Jessica at the Ounce, about enabling conditions, but I've actually been thinking a lot right now about what are the disabling conditions. And I actually think the disabling conditions here, given a lot of the instability around COVID-19 and the pandemic and the huge number of unemployment and economic repercussions we've been seeing, has created some of the destabilizing conditions, but ones that I think can have some positive pieces that we can build up. I was in a conversation recently where it was focused on, like, what is instead of talking about the new normal, which I think we all have gotten familiar with, like, talking about, but their perspective was that I've adopted is, like, what is the next better normal that we should be building? And I've been thinking a lot about what is our next better normal, especially in the space of early childhood. We already had a crisis in terms of childcare shortage in Hawaii before the coronavirus pandemic ever hit. And now it's really clear we don't know how many of our providers are going to be able to actually keep their doors open for the long term. So our 3 entry points, one was kind of just the real shock of the pandemic here. The Hawaii Community Foundation stood up very quickly in March, responding to coronavirus pandemic, the Hawaii Resilience Fund. And it was to do a lot of really rapid grant making across the sector. And one thing, you know, we had kind of an open call. There was no, we really reduced like no application, just put in your request, tell us what you're seeing in your community. And we were getting a lot of requests in, a lot of comments in from childcare providers. I mean, a huge majority of some of the things that would come across my inbox would be from childcare providers. And we realized pretty quickly, I realized pretty quickly, there was especially a gap in funding that could be accessed for family childcare providers. And so luckily I have a great group of people I work with at the Community Foundation. They were willing to entertain my idea of standing up an emergency grant fund specifically for family childcare. And this time we hadn't done a lot of, I mean, just to, you know, we're a broad community foundation, so a lot of our work does touch health and education. We are starting to work towards some of new initiatives around expanding early learning access in the state, but I wouldn't say, like, we're not a big player. People wouldn't necessarily, you know, turn towards us around childhood. But we were so lucky to be able to run this emergency grant program, also with some match funding from Homegrown nationally. And what I learned through that, I mean, we were able to get out 125 grant awards in 3 weeks. And the responses I got back from people, you know, this grant came right at the right time. It was a lifeline for me. And just trying, I think what it was an eye opener for too is that they did actually have some good connectivity through our Department of Human Services, learning about resources, learning from our resource and referral agency, but there was a craving both for more ability to connect with each other and more ability to know kind of real time, like what were some of the opportunities they could tap into. I mean, most immediately, probably some of the financial opportunities. So that's why I'm really so pleased that we're, you know, Carrie and I and others have put our heads together, like how could we start with something small and test out a shared service model here, because I think it comes from a real need in a time that has some real opportunity. The second entry point is one that Carrie mentioned earlier, which is we were in Hawaii through our legislative session. There was a bill to, and now it was approved just on Friday, which is a huge win, but it's basically to expand access for 3 and 4-year-olds over 10 years to early learning opportunities. And in thinking about how would we implement something like that, family childcare is going to need to play a big role in that expansion. One, they're some of the most flexible and trusted environments for our kids and families to be in. Here in Hawaii, just to give you guys a sense, we have, it's about 6% of our childcare providers are family childcare providers, but over 50% of our, where our keiki are in care, especially birth to 5 and our infant toddlers, is in ohana care. So they're with friend, family, neighbor. So if you think about that universe, there's some real opportunities to find ways to network with them. And supporting networks, especially networks more for social change, is baked into the DNA of the Hawaii Community Foundation. A lot of our initiatives and efforts have been in networked models of people and organizations. So this shared service supports feels like a really nice connection to some of the ways we already think about supporting our community. And then the last piece I would say is in the work I'm leading at the Hawaii Community Foundation, it's like hit yourself over the head. You have to ask the question about relevance all the time right now. And I've been leading an initiative called the Promising Minds Initiative, which is about supporting our early childhood providers on becoming more trauma informed and the programs who want to be on a journey to become more trauma responsive. And that work is great, and it does have a lot of relevance right now. We're working with incredible organizations all across the state. But we were poised to start a family childcare specific community of practice, so professional development community through Promising Minds for family childcare providers. And you can't start something like that without asking yourself, how are we going to also ensure that we're taking care of some of those real economic concerns that just on their mind is like, how do I stay open? I have really fluctuating enrollment. And it felt like I couldn't really be authentically doing both without asking myself the question about how we stand up something that's supportive of their overall business structure. So let me pause there. I think I've added a couple things about how we're thinking about it, but we're also really new. So like Mary Louise said, we, Carrie and I worked on drafting like what we might start shopping around with some of our funder partners. The Hawaii Community Foundation, we hope will come in on it. But we are very much at the beginning of that, just getting something piloted and stood up right now.
Great intersections there, Justina, between COVID and your momentum around shared services. Thanks for sharing. Mary Louise, I'm wondering if you have a few additional comments you'd like to share from a funder's perspective?
Sure, I'd start out by just echoing what my colleagues have said about this being the time to take bold action. Childcare has been a priority area of investment for Oregon Community Foundation for probably close to 30 years, primarily through support for the workforce and training and education. But we've seen too little improvement in the childcare system over those years. It continues to be fragile, underfunded, and last year our entire state was classified as a childcare desert. Clearly we have to do something differently, and if we can't do it now, when it's painfully obvious how important childcare is to our nation's economy and our children's well-being, what better time would there be? So it's that, I like Justina's phrase of the new better normal. I think that's what we hope to help achieve. I would also note another entry point for us as a foundation. If our project gets off the ground, it would be a partnership between the education program at the foundation, which I oversee, and our foundation's economic vitality program. We'd be both contributing funding because we see it not only as a child development initiative, but also as a wealth building strategy for women and for people of color. So I wanted to make sure to touch on that particular element, that is a driving motivation for us. And we also expect, we have an active policy agenda. We expect there to be a policy piece connected to this too with our state.
Mary Louise, I think that last point is a great one around really thinking about childcare businesses and the people that run them as business owners and everything that goes with that. So great addition there. So
Shannon,
we've got,
Shannon,
sure.
I just really also wanted to lift that concept up. There are some folks on the call from education and other sectors who may not be as familiar with the fact that the majority of childcare providers are private market-based businesses, whether they're family childcare providers, whether they're small centers. These are small businesses. And we've always kind of approached shared services like Maslow's hierarchy, that you've got to get the fundamentals of the business in order, getting them, Louise talks about the iron triangle, but getting them fully enrolled, getting their fees collected, diversifying their fees, really looking to make sure they're getting all the third-party funding coming in, and giving them the time so that then, like Jessica's wonderful work she's doing with professional development, they have to have enough headspace to be able to engage in professional development in a meaningful way. So that's why we do think it is so hand in glove to look at both their business infrastructure, the strength of their operations, as well as their quality improvement. And I don't even think it's possible to tease those two apart. They have to be sort of meshed.
Absolutely. Great point, Sue. We have one question we're going to take from the field before we wrap up for the day. Wondering if folks want to have, might have something to add around how their state is handling the CARES Act funding. So for any of the panelists that want to jump in and speak to that briefly.
Sure, I can share it just because it's so recent. For Hawaii, we initially got an $11.9 million for the childcare industry. And our Department of Human Services is distributing contracts right now through them to get that money out. We were also able to, through the last legislative session, getting an additional 15 million from the state CARES Act dollars to go towards childcare industry to help sustain it. In addition, there was 100 million passed for PPE support. It was originally just for nonprofits, but to Sue's point, I don't think people truly understand that most of our childcare is market-driven businesses. And so our Department of Human Services advocated, along with many others, to make sure that that pot of money could be distributed to childcare businesses as well. And then third was, we had to pass through the legislature, allowing our Department of Human Services to do grants. And so all of that was packaged into one bill that passed last week. And so we'll be able to hopefully get some of that grant money out as quick as possible, because we know that a lot of our providers are, as they say, hemorrhaging financially right now.
Thanks, Carrie. I think we're going to go ahead and transition to closing comments. So I just ask my panelists to share their final thoughts.
I think I'm first, right?
Yes, Judy.
Yes. Yeah, thank you again for including Early Learning Ventures in this great conversation. I think my closing thoughts are echoing everything. I think that the key is that these childcare businesses, family childcare homes, these small centers, and even some large centers, they are small businesses and they need to be supported to strengthen their business. And I also think that it's very important to bring value and benefits to those programs, what they're asking for, what they need first so that they can get on stable footing. And then I also think that the key for a shared services network is that does give the advocacy, because it shouldn't just be it's up to childcare providers to get themselves stable and fiscally. There's a lot of moving parts. Once they're as stable as they can be and fiscally, there's got to be more money put in for delivering high quality care. Kind of echoing on the CARES Act, Colorado got 40-something million. Half of it went to emergency care for essential workers, which was really important. And we're still waiting for grants for childcare programs because they have lost their enrollment and they need access to dollars. So again, I think it's imperative that technology is used, because then you can quickly see all of the record keeping, the children that are being served, the compliance, are they participating in programs, and you can really quickly get that support to them. But they also need the advocacy of understanding, how do I apply for a PPP? Where are there grant opportunities? Can you help me? And so forth. So it needs to be 360. Everybody that wants to help childcare needs to help together and support the services together, I guess would be my last parting thoughts. So thank you.
I'll be super brief. I would say, since I know many local philanthropists are on the call, there is a key role for you right now in keeping our childcare sector thriving, especially family childcare. I encourage you to think about investing in emergency relief grants, supporting PPE and access to technology, as well as investing in those organizations that are closest to the ground and have the deepest relationships already with family childcare educators, such as staff family childcare networks. The last thing I'll say is, I think you have a powerful advocacy voice, and I hope you will use that at the state and national level to really advocate for increased funding for childcare during this critical time.
Great, thanks, Jessica. I think I'm up next. I'll be short also. I just to put out there, we're learning and we're looking forward to learning from everyone, all the panelists, but also everyone on the call. We know that there's various types of shared services across the nation, and I'm so happy to connect, happy to reach out. We look forward to sharing what we're learning as we roll this out as well, and just really grateful for childcare, and especially family childcare, being prioritized at this critical time. So thank you, everybody.
My closing thought is a little bit coming from, this is actually from my dad, who would often say this to me as a kid, but he said, don't put off tomorrow what you can do today. And I really think that's such a true statement right now, because there's a moment that has created some very unique conditions for us to take on, at least take our first step on what we could do better to support our whole childcare sector, but especially our family childcare providers. And I feel very lucky that we have this network of people we can reach out to who've done some both shared service, but also the deep work around how you build relationships and network family childcare providers together. Because surely we will mess up along this journey, but we'll mess up less because we've benefited from great conversations like this. Thank you.
I like that. That's going to be my new mantra, messing up less. Thank you, Justina. I would say as a closing comment that I think for the funders on the call, I think philanthropy is uniquely positioned to serve in a role in getting these networks going. We tend to be a little more risk-taking than government. We're a little more nimble than government. And the fact is we can bring more tools in our toolkit. You know, the fact that we've actually housed early learning ventures in our office for a decade now. You know, we were able to do that because we had the capacity to do that. So think about what unique assets you have as funders that you can bring to this to get these networks going. And then we can start to look at other sources of funding, public and member dues and things like that, just to sustain them. But I would really encourage you to think about yourself in a sort of a venture philanthropy role when it comes to shared services. Thank you.
Mary Louise, a closing thought?
Sure, I would agree with as a funder, what Sue just said about our role as venture capitalists and able to act more nimbly and to take more risks and be innovative. At the same time, one of the reasons we are embarking on this path now is because we know that our state early learning division is interested in the Shared Services Alliance model as a structure within which to work with childcare providers serving low-income children and families in the future, with much yet to be figured out about what that would look like. But we've considered it to be very important to be aligned with the state and to be heading in a similar direction. And we expect that we will stay aligned and be in conversation with the state early learning division as our initiative moves forward, if and when it does, so that we are building something with them. And because that's a system change strategy, it's potentially a sustainability strategy. And it's another reason it's a moment in time to be looking at this.
Thanks, Mary Louise, and thanks to all of our panelists. I have one quick parting thought. I just want to echo the call to action. Now is definitely the time. And to those of you that are considering embarking on a shared services venture, I would really encourage you to be thoughtful about technology, because it is essentially the infrastructure that provides the foundation for scaling those efforts later. So with that, I'm going to kick it back to Jill. Jill?
Yep. Oh, there we go. Now I'm unmuted. As I was saying, we'll go through the chat and the Q&A to make sure if there's any questions we couldn't quite get to, that our discussants have an opportunity to look at those and weigh in. We want to thank all of our discussants today, Shannon as our moderator, and everyone else who's on the line, Sue, Judy, Jessica, Justina, Mary Louise, and Carrie, who had to, not within her own control, had to sign off a little bit before the bottom of the hour, but Justina is representing well the great state of Hawaii. So thank you all so much. We also want to thank our underwriting sponsors and our sponsors of GLR Week 2020, the Bainham Family Foundation, the Bezos Family Foundation, the Heinz Endowments, the CPB PBS Ready to Learn Initiative, Annie Casey Foundation, and the Wincoat Foundation. You can go to the next slide. The list here represents our enterprise investors for the campaign at a wider level, not specific to GLR Week, but related to our work overall. So thank you very much to all of our sponsors, all of our enterprise investors and our funders that support the work the campaign does. And you can go to the next slide. And just a last reminder, we're nearing the end of GLR Week, but we do have two really important conversations that we're sponsoring that are going to be happening tomorrow. One that's actually being sponsored by McKinsey and Company, COVID-19 in Education, Ensuring Equity as we address COVID-19 learning loss. And then one that we're sponsoring, Measuring and Addressing Learning Loss with Innovative Diagnostic Tools, lifting up California and South Carolina, just as you heard several states lifted up today. You can go to the next slide. And then a last plug, we have our regular GLR Learning Tuesdays webinars every Tuesday from 3 to 4:30. If any of you come on the one that's happening on the 21st, I'll be moderating that as well, looking at how informal places and spaces can advance early learning and literacy, which is an exciting topic. And then we'll be looking at relational health and partnerships around relational health, partnering with families related to relational health on Tuesday the 28th. And next slide. And then lastly, we have our funder to funder conversation series. So there are many funders on the line. Please join us on the 21st and on the 28th. And information for registering for the funder to funder conversation series will be sent out as part of our post-webinar discussion, our post-webinar materials that we'll send very shortly near after. I really love the quote. I think it may have, I'm not sure who said it. I think it was maybe Justina, the new better normal. So if you want to go off the screen share, that way you can see all of our discussants one last time before we sign off. I love that idea of the new better normal. I think all of you are inspiring what a new better normal will look like at a state level, at a community level, at a national level, and impacting many, many, many families around this country that need it even more so now than ever. So I appreciate the call to action to the new better normal. I want to thank everyone on the line for participating and weighing in with your questions in this fishbowl conversation. And we look forward to seeing you at future GLR events and conversations as we go. Thank you so much. Stay safe and healthy, everybody. Thanks a lot.